Now with Dr. Michele Barry. Dr. Barry is the Dean of Global Health at Stanford University and the Director of the Center for Innovation in Global Health. She is also a past ASTMH president. First question I wanted to ask you, thank you first for joining me, is what did you think were some of the highlights of this year's ASTMH conference? I could just hold it.
I think this is such a diverse meeting, but I think that the exciting aspects of this meeting were really the vaccine presentation on the irradiated sporozoite vaccine from malaria, which looks like it's 100% effective in a small study, and now it's being rolled out to many other countries. I think the vesicular stomatitis virus for Ebola, which also looks like it's 100% effective, even though, unfortunately, there were not enough people enrolled to say that this reached significance, but I think it's very exciting news.
Great. So this is the 64th annual meeting of the ASTMH. So what was the first meeting that you went to? In what year?
Well, it wasn't number one, but I have been a member for many years. I've been a member when the society was actually a society of maybe between 500 and 600 people, and now this year we've hit over 4,000 people. I think what's so wonderful about the society is how diverse it is, that the clinicians are rubbing shoulders with the basic scientists, with pharma, with the Gates Foundation. It's really the go-to tropical medicine meeting for also our overseas members. A quarter of our membership is now from overseas. So it makes it a very exciting and vibrant meeting.
Yeah. And so you kind of answered my question, which was really how the meeting has changed and grown over time. So it's really exciting that there is so much more diversity. Last question before we go. Is what brought you to study tropical medicine in the first place when you first started your career? So you've been doing this for a long time.
So I had a very specific plan why I learned tropical diseases. My career really started with refugee health after the Vietnam War, and for political reasons, I became very interested in refugees that were coming over here, and it was clear that there was no school teaching tropical diseases in the U.S. It was really basically the military or the London school, and so I got very interested in getting trained in that, and then made it my passion to actually make sure that there was training in the U.S.
Yeah.
So helped start the first certificate diploma programs in the U.S. because it was my passion to make that accessible to other people.
Thank you.
Copyright Stanford University, all rights reserved.